Everybody, it's Monica Heltz with your daily Fishers Health Department update. Today is Tuesday, October 27th, and because it is Tuesday, today is the day that we will do a full review of our metrics and reconsider our community risk rating scale. Our metrics today, the primary ones that we consider again are the county percent positivity rate based on individuals tested as reported by the State Department of Health. You can go to the State Department of Health to find that rate. Today it is 8.8%. We also do post it on our community dashboard that you can find posted below, as well as on our website every day. So again, that rate is at 8.8%. That is in our orange category, or level 3 significant risk category. Our case incidence rate is at 18.74, which basically means we have about 18 cases per day that we're getting averaged over the last 14 days. That's a marked increase from what we had been seeing, and that's clearly in our orange level. We've been in orange for a while, but this is even a bigger increase from that. So both of our major metrics are in orange. We are going to be moving our community risk rating scale to orange today. We do have a bunch of suggestions for you on our website. I would encourage you to look at that and look at the associated recommendations that we have. Well, we've developed a bunch more from what were originally posted. So please do review those to see how you can take additional steps to protect yourself and your family and your community from COVID as we increase our community transmission risk level. Our Fishers Health Department testing site that we also typically report on, our percent positivity right now is at 5.77% at our Fishers Health Department testing site. So that's in the yellow category. That has also seen an increase over the last couple weeks. So we are keeping an eye on that. The other metrics that we look at for supporting information are public health capacity, which is looking pretty good, and our hospital system capacity, which I'll talk about in a minute. So from a public health capacity standpoint, our testing availability is very high. We can get you an appointment the very next day if you need to. So that is in our green zone. We have added additional testing capacity to handle an additional 150 to 200 people per day. So if you have any questions about getting tested, I would strongly encourage you to come through our site or get tested wherever you want to be tested, but we can definitely handle it. So please get tested if you're having symptoms, if you're visiting somebody, if you have any questions. Testing availability, again, very high and in our green category. Our testing turnaround time right now is at less than 2 days. It's actually closer to 1 day, and that's for our Fishers Health Department testing site for the additional testing that we're offering, and for any site that I'm seeing right now getting reported, it's 1 to 2 days as far as how long it's taking the lab results to be returned. So testing turnaround time, very good. You should definitely be receiving notification very quickly. Contact notification is a little less good right now. Fishers Health Department contact tracing team is working very, very hard to get everybody notified that we know about immediately, and to do that contact tracing ideally within 24 hours. But the State Department of Health is having a bit more of a delay. I'm not sure of the reasons for that. But in general, I would say on average for Fishers residents, we're in the yellow category for that when we look at all of the data, because we are seeing contact notifications on average definitely more than 24 hours. So that has our capacity for that has decreased a little bit since our last report. As far as our hospital system data, what we typically look at is our District 5 data that's available on the Regenstrief dashboard, which you can connect to from the State Department of Health. District 5 is basically Marion County and all the surrounding counties. So these are the hospital systems that we are most likely to use. So that's the data that we look at. What they are reporting right now is that there is an increase in positive testing for COVID in the hospitals, positive test reports, I should say. In the hospitals, there's an increase in emergency departments visits, and there's an increase in hospitalizations right now in District 5 hospitals. So this is a poorer report than we've seen in the last couple of weeks. That moves that metric into yellow on both counts as well. We are not seeing an increase in ICUs, in ICU admissions or deaths right now in District 5. However, I will mention that statewide, we are clearly seeing a dramatic increase in cases. They reported on Indiana throughout the news. We're clearly seeing an increase in deaths. Again, you can explore this on the State Department of Health's website, and clearly seeing an increase in COVID cases in hospitals and admissions. So Please, please, please continue to use your measures to stay careful, wear your mask, limit your contacts with others. Now is really the time to keep those social bubbles small, try to not go out too much and interact with too many other people. And continue the measures that we know work. Get tested, get tested, get tested if there's any question. Thanks so much for listening, you guys. Again, visit our website for some more tips. Take care. Be safe.